I'm Vicki Liviakis, and welcome to Body Beautiful. This is a show where we talk with local professionals about the very latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have plastic surgeon Dr. Joseph Mele, our favorite, and we're doing a countdown of the top 5 most popular cosmetic plastic surgery procedures. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And of course, any advice we give you today, you'll want to consult your own physician as well. Always good to get a second opinion. Welcome back to the show, Dr. Mele.
Thank you. Nice to be here.
First, we want to establish, we're going to talk about the top 5 plastic surgery procedures, but that's minus any of the liquid facelifts, the Botoxes, the injectables.
There's about 13.8 million cosmetic procedures were done last year in the U.S., and that's from the American Society of Plastic Surgeons. 12.2 of those were the minimally invasive, majority being Botox and fillers. The remainder are what I call real plastic surgery,
the real
or
deal.
Surgery that requires a board-certified plastic surgeon.
All right, can I extrapolate that when people say, no, I haven't had plastic surgery, if they've just had Botox or Restylane, Perlene, and Radiesse and Juvederm, all the various and sundry
Some
chemicals
people
out
don't
there,
consider that plastic surgery.
doesn't really count?
Yeah.
Okay. All right, let's jump right in. Let's start from the bottom and then work our way to the top.
Okay.
What's the 5th most popular cosmetic procedure?
The 5th most popular, and it's kind of a tie between tummy tucks and facelifts. So both of those are very common procedures, different age groups usually. Tummy tucks more common in women who've had children or younger. Facelifts, obviously, as we get older, our facial skin gets a little looser. So
we actually have some photos of those procedures as well, so let's go ahead and take a look here. That
Here's
is a facelift. Is that a full-on facelift?
That's a full-on facelift, yep.
Because we hear a lot about the minis.
Yes, yes. Minis are great for mini problems. If you try and do a mini in a situation where there's a lot of extra skin, initially it'll look great, but it'll be a short-term affair. It'll tend to come back quite quickly.
This is an aesthetic observation here, but she looks very natural. It's not too tight.
That's the plan. The plan is tight enough, but not too tight.
But that wouldn't go over in Hollywood, because in Hollywood they like them where it really shows.
Well, I think there is a personal preference. There are some folks who really want every last wrinkle pulled tight. The problem with that is there's a price to be paid with distortion. And we can get facial distortion and things become obvious that something was done. Okay,
let's go ahead and look at the next photo that you brought. This is a tummy tuck.
And this is a tummy tuck.
Is this like a mommy makeover?
Mommy makeover, exactly. After having children, the abdominal wall, the muscle, the skin gets stretched out. There's a little bit of fat in the lower part, but really she's not overweight. No. Just had a lot of extra skin. Hard to see on the monitor here, but she has a lot of stretch marks in the lower part of the abdomen. And those, since that skin is removed, those go away also.
I was going to say, how did you get rid of stretch marks? Because
it's
that's
the only way I know.
Of many women's existence. Once the body has been stretched out of proportion with
well, it's a combination of the stretching and the hormones, and it causes a tear in the deep part of the skin, and we don't really have a good way to repair that.
So no amount of cocoa butter?
I think it's helpful. I mean, the moisturizer and the massage help, especially during the stretching during the pregnancy, but afterwards, I don't think it helps a lot.
So part of the mommy makeover, the tummy tuck, you're actually taking that skin and somehow, what do you do with it?
We get rid of it. We just take it away and tighten everything up by closing that space.
Okay, so she's wearing a bikini, and so the cut line would be somewhere.
So there's an incision low, and the goal is always to keep it low enough so it's hidden by the bikini.
Okay.
Works very well.
Now, there are 2 totally different groups, as you indicated, demographic groups.
Yes.
They say the facelifts generally would be for someone who's older. In the tummy tucks, someone who's just in childbearing years.
Sort of 50s is kind of the average. There'll be some before and some later. The tummy tucks, probably more in the 30s is more average.
And I know we've spoken about this before, but it's a very important point. With the tummy tucks, generally you have to be done having your children. This is not a good idea to...
It's a good idea to be done having children. It won't keep you from becoming pregnant. Your belly will still stretch out, but that's the problem, is then we lose our results and we have to do it again. So tummy tuck's better to do that afterwards. There are some exceptions, though. There are some folks who were very, very heavy at a young age who will get a tummy tuck. We may not tighten the muscle up as much underneath, but certainly getting rid of all that extra skin can make them feel better.
Okay, and how long facelift? About 5 years, 5-10 years?
5-10 years, somewhere in that range. In fact, there was just a study came out in one of our journals showing that the facelift on average puts people back about 7 years.
Okay, now we've got the countdown and it's going, but we need to take a very quick break. For more information about Dr. Mele, you can call him at 925-943-6353, or you can check him out on the web at drmele.com or on sanfranciscobreast.com.